Talking about why people become addicted to substances, anything for any kind of a substance. What's the hereditary factor? What's the environmental factor? What type of psychoactive substances are we dealing with here? So let's go ahead and get started. This is chapter 2. Okay, psychoactive drugs are substances that directly affect the central nervous system. The method that a drug gets into the brain are called pharmacokinetics, literally drug movement. Pharma means drug, kinetics means movement. How is it absorbed? How is it distributed throughout the brain? How does it get rid of it? How is it metabolized? So how do they break it down? And then eventually, how do they get rid of this stuff? How is it eliminated? Pharmacokinetics have to do with the route of administration, and this is a lady that is she's cooking opium and she's sucking it up through the straw. That's one way to do it. Speed of transit to the brain, how fast does it get to the brain? The affinity for nerve cells and neurotransmitters. When a psychoactive drug can get to its target in the central nervous system rapidly, the more addictive it tends to be. So the faster it gets into the brain, the harder it is to get rid of. Routes of administration and drug absorption, inhaling. When a person smokes a psychoactive substance or draws it in as a vapor, as with nitrous oxide, or inhaling an active chemical solvent, colloquially referred to as huffing, the drug enters the individual's lungs. The drug is rapidly absorbed through the capillary lining of the alveoli of the bronchi. The psychoactive substance travels through the body with the blood and is pumped to the brain and the tissues of the body and may reach the brain in as short as 7 to 10 seconds. Inhaling is the most rapid method of getting a psychoactive substance into the system. Individuals are able to control levels and reactions of the psychoactive substance known as titration by regulating the frequency of use and the depth of inhalation. This is why most tobacco smokers spend more time holding their cigarettes than actually puffing on them, except in this guy's case. Wow, that's a lot of tobacco. Since smoking is an inefficient means of administering the psychoactive properties of marijuana, the THC of marijuana, 60% of the substance is lost. Pharmaceutical companies are working on aerosol and nasal sprays to deliver the THC to such medications are Marinol and Dronabinol. This method would also eliminate the tars and other toxic substances that make marijuana carcinogenic. And of course, was one of the arguments that was being used prior to the legalization of medical marijuana, that there were other options that could be used, but not a lot of takers, unfortunately. Injecting is where the individual introduces the psychoactive substance into the body by using a hypodermic needle and a syringe. There are 3 methods of injecting appropriate psychoactive substances into the body. Intravenous, into the vein, colloquially known as slamming, is where the psychoactive substance is injected directly into the bloodstream. This method delivers a psychoactive substance through the bloodstream into the brain in about 15 to 30 seconds. This method is the most likely to create a head rush, an intense feeling of excitation, and mental electricity. Intravenous. Intramuscular, into the muscle, colloquially referred to as muscling. The psychoactive substance is injected directly into the muscle. This method of introducing psychoactive substances through the bloodstream and into the brain takes about 3 to 5 minutes. This is how nurses will inject most individuals. They'll inject it directly into their muscles. Either that or they'll put it in their IVs, which gets it into the system faster. This method will create a head rush, but a slower buildup will not create a head rush, but a slower buildup of euphoria. Subcutaneous, under the skin, colloquially referred to as skin popping. The psychoactive substance is injected directly under the skin. This method of introducing psychoactive substances through the bloodstream and into the brain takes about 3 to 5 minutes. This method will not create a head rush, but a slower buildup of euphoria, just like muscling. And that's what it looks like when people are skin poppers. I had a friend up in Montana who was a skin popper, and he had these circular scars all over his arms. Injection is the most dangerous method of introducing drugs into the body because once they are entered, there is no turning back. Injecting also introduces the user to a whole host of contaminating infections such as hepatitis B and C, syphilis, and HIV. The individual is also more prone to abscesses and embolisms. Embolisms is another word for blood clots. And this guy is not dead, by the way. He is still alive. I think he's an actor. No, so, that's pretty close, though. Mucous membrane absorption. Select psychoactive substances that come in a powdered form can be inhaled through the nose and absorbed in the capillaries found in the mucous membrane. You can do this with cocaine, with heroin, methamphetamines, and you can grind up OxyContin, and that will work if you snort them. This method is much more rapid than oral ingestion and bypasses most of the body's defenses, such as digestive acids, enzymes, and the liver. Besides snorting through the nose, there are 2 other methods used, buccally between the gums and cheek, like snuff or snooze, and sublingually under the tongue. And this guy's raising his tongue up so somebody can put something in his mouth. That's the way they administer, what is this stuff? Oh, shoot, it was just there and now it's gone. The stuff that they give for the pain of a heart attack. What is TNT is nitroglycerin. Nitroglycerin, I'm sorry. I don't know what I was thinking of. Absorbing drugs through the mucous membrane in the rectum and the vagina are also possible. This is usually administered as a suppository, but can also be used for recreational drugs such as ketamine and cocaine, etc. I have heard of individuals soaking tampons in alcohol, especially tequila and vodka, and putting them in their vaginas. I've also seen way too many times when somebody puts something up their anus. This is a case of an individual who put some kind of a can up into their anus, and theoretically it was supposed to go off at some point. I've got some horrible, well, they're not that horrible stories. People put really strange things for sexual purposes, of course, and well, we don't really need to discuss that. It's just a fact of their life anyway. And unfortunately, since I was working in the emergency room, it's a fact of my life as well. I got to help extract some of these things. And then once they're extracted, they have to be taken to the lab. So that's usually how I got involved. I was there waiting for the specimen so that I could take it downstairs or upstairs, whichever the case may be. Emergency rooms are always on the first floor. Labs are very often in the basement, but ours was on the first floor at St. Joseph in Omaha. Oral ingestion, when a drug is swallowed, it goes through the esophagus into the stomach. It passes into the small intestine where it is absorbed by the capillaries and the mucosal lining of the intestine. This method requires between 20 to 30 minutes before the drug begins affecting the brain. So when you take an aspirin, it should take about 20 minutes before the aspirin needs to be broken down and get into your system. Usually it will get into your system in the stomach, from the stomach, unless it's a time release, has time release capsules in it. So if you take an aspirin, it should take about 20 minutes for your headache to go away. Most people, they take an aspirin, it's all gone, but that's okay. If the psychoactive substance is a beer or other alcoholic beverage, about 10 to 20% of the substance will be metabolized by the stomach, so most of it goes away. Males tend to metabolize alcohol faster than women, and thus they get drunk slower than a woman who consumes the same amount of liquor. One of the differences between males and females is that males have more alcohol dehydrogenase in their stomach, and they break down more alcohol than the female will, than a woman will, because of the alcohol dehydrogenase. Most psychoactive substances are fat soluble, and so they move rapidly across the membranes. Alcohol is both fat and water soluble, so it gets into your system really quick. That's one of the reasons why you drink a beer and you start feeling it about 10 or 15 minutes later. Transdermal absorption, drugs are now being impregnated on adhesive patches so that the medication can be slowly absorbed through the skin. Some of these patches provide medication for up to 7 days, though it may take as long as 2 days before a therapeutic level of the drug makes it into the system. Because of various factors, psychoactive substances in the blood do not remain in the system for the same length of time. This is known as bioavailability. There are various factors that restrict the availability of the psychoactive substance to the target tissue after administration. Once a psychoactive substance enters the bloodstream, it can be transported inside blood cells, it can be transported in the plasma, it can attach itself to a protein molecule. The psychoactive substance will visit every organ in the body where it will cause an effect, or it might be ignored, it might be stored, usually in the fat cells, or it may be biotransformed. In other words, it may be broken down into chemical variations that may or may not cause psychoactive effects. So it could either do something, it can be completely ignored, it can be stored like THC is stored in the fat. So if you smoke a joint right now, that stuff will be in your system for about 21 days, 18 to 21 days. Because it's in your fat and it'll be there. So how long will you be positive? Well, it all depends on how much you smoke, and it has to do with how much fat you have in your system and whether you try to flush it out with something. There are ways of getting around all this stuff, but most of them don't work very well. While the chemical structure of the drug is a factor in distribution, so is the size of the individual. A lighter person with less blood volume will have less blood to dilute the chemical. The blood volume of an adult is 6 to 8 quarts of blood. Children may have 3 to 4 quarts of blood, and therefore, of course, it would affect a child much more readily than it would affect an adult. Organs with extensive vascularization will be affected by a drug to a greater degree. This is one of the reasons why cocaine can cause fatal heart reactions. Too much of the drug affects the highly vascularized heart, causing arrest. The other thing that you need to know about cocaine is that it's a vasoconstrictor, and because of that, it's fairly severe vasoconstrictor. And for that reason, a lot of times, if the individual has a problem with their heart, then cocaine will, especially a large dose of cocaine, will really affect their heart. I mean, it will shut it down. It will squeeze off the blood vessels. Now, normally it just makes you feel high, but if you get too much of it, then potentially it will kill you. This is what happened to, let me see, what is this, was this guy to me? He was my, they were my nieces. It was a guy that was married to one of my nieces from Chicago, and he was a notorious user of amphetamines, methamphetamines, and one day he got a hold of some cocaine, snorted it, and he had a fatal heart attack at age 39. There you go. He had not been using cocaine. He had been using methamphetamine, and he was used to that, thinking, "Oh, this is cocaine. It's more expensive. It must be better." And he snorted it one time, and it killed him. Humans would have died from bacteria, viruses, and toxins at the beginning of our evolution if it weren't for our ability to keep most of these substances out of our central nervous system. The walls of the capillaries that feed the nervous system consist of tightly sealed epithelial cells that only allow certain substances to penetrate. This is known as the blood-brain barrier, and it has kept us alive for our entire evolution. Luckily for those who need a chemical assistance to their lucidity, psychotropic medications do cross the blood-brain barrier and change serotonin, GAB, and other neurotransmitters to reduce the symptoms of depression, anxiety, or whatever. The chemicals that people use as psychoactive substances also will cross the blood-brain barrier. Otherwise, they wouldn't be taken since there wouldn't be a brain reaction to them. And of course, once again, and I have a lot of pictures of Amy Winehouse. I apologize. She died of alcohol overdose. So we'll talk about her from time to time. Poor Amy. Died at 27. The reason psychoactive substances cross the blood-brain barrier is because the brain is very fatty, and most psychoactive substances are fat soluble or lipophilic. That is the case with nicotine. That's the case with alcohol. That's the case with marijuana. This is, what is this? How long it can be detected in your urine: 2 to 4 days for amphetamines, 4 to 7 days for barbiturates, benzodiazepines 3 to 7 days, cocaine 2 to 4 days, ecstasy 1 to 3 days, methadone 3 to 5 days, methamphetamine 3 to 5 days, opiates 2 to 4 days, opiates, that's morphine and opiates, the other opiates 2 to 4 days. Phencyclidine, that's angel dust, 7 to 14 days. THC, 15 to 30 days, and there's a huge variability there, but 15 is a lot of days. That's 2 weeks. Tricyclic antidepressants, 7 to 10 days. Propoxyphene, 1 to 2 days. Oxycodone, 2 to 4 days. Amphetamines, 2 to 4 days. Cocaine, 2 to 4 days, and methamphetamine, 3 to 5 days. So if you're going to have to take some kind of a drug urine test, there you go. Most of the stuff you take is going to stay in your system for 3 to 4 days. And if it's marijuana, it could be a month before it clears your system. Drugs that are completely fat soluble will cross the blood-brain barrier very rapidly. Drugs that are only partially fat soluble will cross the barrier much slower. This is the case with morphine, which crosses the barrier much slower than heroin does. This form of crossing the barrier is known as passive transport. Active transportation takes place when a water-soluble or hydrophilic chemical needs to cross the blood-brain barrier. A water-soluble chemical must first attach itself to a chemical structure that will readily cross the barrier. In the case of cocaine, cocaine hydrochloride attaches itself to a protein molecule. Most water-soluble substances, such as antibiotics, will not cross the barrier. And this is a good thing. You don't want all those antibiotics in your brain. The blood-brain barrier does not completely develop until the individual is 1 or 2 years old. So if your child comes in contact with this stuff, it's going to get into their brain, and it could do a lot of damage. Toxic chemicals that will not injure adults cross an infant's barrier and can cause brain damage. So this means if mom uses while she's pregnant, the baby is SOL. The placental barrier protects the developing fetus from water-soluble chemicals, but since most psychoactive substances are fat-soluble, the fetus uses what the mother uses. The fetus uses what the mother uses. I have a great niece. Yeah, she's my great niece. And she was a heroin addict, and she got pregnant. And she's smarter than the average anybody else. So she used the entire time that she was pregnant. And she gave birth to a baby that was strung out on heroin, as cute as that is. He made it. He's still alive, but and he's 7 years old now. but he's got anger issues. He just all of a sudden will explode for no reason at all. And he'll start throwing things. Now you might think, hey, he's just spoiled. He's not just spoiled. This is something this has to do with his mother's addiction, and the fact that he was addicted when he was born. The body is always trying, and he's in special ed. They can't put him in a class. They can put him in a classroom, but if he has an episode, then they have to leave him out because he can injure people. He's a pretty big kid, and it's kind of a unfortunate situation. But it is my relative, so what am I going to do? The body is always trying to rid itself of foreign substances, whether they are harmful or helpful. It does this in two ways: metabolism and excretion. Metabolism is the processing, using, and inactivating a substance. Most of this takes place in your liver, and that's what your liver looks like. It's right above your kidneys, right there. Your kidneys down here. This is your liver. It's right. If you suck in your stomach and you lift right underneath your rib cage, that on the right side, that's where your liver is. Okay, and probably, unless you've taken in toxins through in your life, you probably can't feel it. It's big. It's a big chunk, but it's right there underneath your rib cage. Unless you've been a drinker or unless you've taken other substances, and then portions of it will die, and then it will expand. One time, here I'm laughing. I apologize. One time I was working in a clinic in Oklahoma, and the doctor called me and he said, "Feel this, feel this." And I felt underneath the guy's ribcage. I can't feel anything. And he said, that all the way down to his pelvis, that's his liver. It had distended that much because the guy was an alcoholic. And he just wanted somebody else to verify the fact that it was a hard mass all the way down to his pelvis. He didn't live very much longer after that. His liver was pretty shot. Anyway, okay, so that's the metabolism. Excretion, expelling the foreign substance, and it's metabolized from the body. This takes place mostly in the kidneys, and this is one of the reasons why. This is one of the reasons why we have this list, because that's how long it takes for that junk to get out of your system. When the liver metabolizes alcohol, it breaks it down into water and carbon dioxide and excretes it from the body through the urinary tract, through your sweat, and as vapor from the lungs. And I can tell you, I've had lots and lots of experience with drunk people. This is Lindsay Lohan, of course. I think she just recently got married. Maybe she's a little bit more sober than she was in these pictures. But I can tell you from working in the emergency room, you can smell it on their breath. And for a while there, I was working with a nurse that she would smell somebody's breath, and she could tell how much alcohol they had in their system. Of course, so what does that mean? When we're trying to measure the alcohol, we usually draw their blood and we take it down, and that's how we measure the blood alcohol level. And she was really pretty close. The liver breaks Valium into four metabolites that are actually active in themselves and affect the brain, and that's why Valium works so well. Measurement of the metabolism or elimination of a chemical is the half-life. It takes 6 half-lives to break a chemical down so that it isn't detectable. It takes 6 half-lives. Cocaine starts breaking down 30 to 60 minutes. It's detectable to 3 to 6 hours. Methadone, 15 to 60 hours. It's detectable up to 15 days. THC, 20 to 30 hours. It's detectable for 5 to 7.5 days. Prozac, 1 to 6 days. Detectable for 6 to 36 days. Now, why Prozac and methadone? Prozac and methadone are both medications. Cocaine and marijuana are not medications, so we try to, the methadone and the Prozac, we try to leave it in your system for as long as we possibly can. THC, this is not the same as what we just saw. but this is not exactly what we're talking about back there. So every 20 to 30 hours, the amount of THC in your system breaks down. Now the problem with THC is that it's fat soluble and it gets into your fat, and therefore it is detectable for up to 30 days. Clearing the system is based on many factors, so none of these figures are absolute, and this is we're going to start talking about some of those factors. Age is a factor in the metabolism of drugs. After the age of 30, the liver begins producing fewer and fewer enzymes to metabolize select chemicals such as alcohol and the sedative hypnotic drugs. So the other problem is the more alcohol you've had before age 30, the more damage you've done to your liver, and actually it is slower. The enzymes, it's got fewer and fewer enzymes. It also has damaged cells, so it doesn't do a very good job. So age can be a factor. Race has been shown to be a factor in levels and types of enzymes maintained in the liver. Caucasians tend to maintain enzymes used to metabolize alcohol rapidly, while Asians metabolize alcohol slower and with more side effects, quicker drunkenness, and a rapid flushing of the face. Caucasians are like professional drinkers, if you think about it, because Caucasians have been drinking for thousands of years, not 10,000, tens thousands of years, but they've been drinking alcohol for thousands of years. And if you think about the indigenous people of the Americas, they've only been drinking alcohol for about 400 or 500 years. So that's one of the reasons. All the people that, all the Caucasians that potentially would have died, most of them died out a long time ago, and that's one of the reasons why Caucasians tend to be able to hold their liquor. Why? Because they're professional drinkers. They are genetically professional drinkers, as weird as that may seem. Asians, they're really kind of funny. Drink, one beer and their cheeks just get rosy red. It's really quite entertaining. Well, if you like red cheeks, I guess. Hereditary factors can affect metabolism. Some people inherit fewer enzymes. Some people inherit more body fat to store drugs. Some people inherit a high metabolic rate to help eliminate drugs. Health can affect metabolism. Unhealthy people tend to metabolize chemicals slower or less completely. For example, the individual may have severe liver damage due to hepatitis or cirrhosis. And that's what cirrhosis looks like. This is a nice and healthy liver, and this is one that is cirrhotic. Cirrhosis means death, dead. The individual's emotional state changes the effects of a drug. Anger or anxiety in a person using methamphetamines may cause episodes of lashing out or violence. And there's old Tweaks Harlow there doing something, not sure what. The presence of other drugs will delay the metabolism of select drugs. When alcohol is used with Xanax, the Xanax will stay in the body 2 to 3 times longer than normal. This delay of metabolism and exaggeration of effects is called drug synergism. Not everyone's body chemistry is the same. This is why some people are allergic to select drugs and others aren't. Some people lack the enzyme that metabolizes cocaine, so even a small amount in the system will result in an exaggerated reaction and even death. An example of that is that I am not sensitive to opiates. Now, you might think, well, and that's what they knock people out with when they do surgery. Now, you would think that almost everybody's sensitive to opiates and opioids, and the answer is you're right. It's only about 5% of the world's population have an unsensitivity, desensitivity to opiates and opioids, but I mean, everybody's different. That's the whole point. Now, is this part of my genetic structure? Potentially it is. My sister reacted negatively to opiates and opioids. It made her sick to her stomach. She couldn't take them. Neither of my kids have had surgery, so I don't know if they're sensitive to opiates or opioids. But obviously, my great niece is. Now, my great niece really doesn't have any genetic material has very little genetic material that I have. So the probability of her taking after me is fairly remote. Other factors that can affect the metabolism of a psychoactive drug: your weight, your level of tolerance, your monthly hormonal cycle if you're a woman, enzyme induction, enzyme inhibition, and weather. Strangely enough, when it is stormy weather, when the barometric pressure is low, then drugs can get into your system faster. So if you drink a beer on a sunny day, you probably won't get drunk. But if you drink one on a cloudy day, like what we're seeing here, then potentially it will give you a little bit more of a buzz. In order to understand the effects that psychoactive substances have on the nervous system in general and the central nervous system in particular, we need to review the various nervous systems that control our bodies. The nervous system can be divided into two basic parts: the central nervous system, which consists of the brain and the spinal column and controls most of our nervous responses, and the peripheral nervous system, which encompasses all other nerves outside the central nervous system and communicates impulses to the central nervous system. The peripheral nervous system collects information, sends it to the central nervous system, which then responds to the stimulus back through the peripheral nervous system. The proper response will be through the appropriate system of the body, and these are the systems of the body: the nervous system, the skeletal system, the endocrine system, the digestive system, the respiratory system, muscular system, circulatory system, urinary system, the lymphatic system, and the integumentary system, which is your skin. Psychoactive drugs may alter information headed for the brain. Painkillers block the chemicals that tell the brain that they are in pain. Psychoactive drugs can disrupt messages sent back to the parts of the body. When someone is so drunk that their hands and feet don't work properly, there you go. Disrupt your messages, go into your hands and feet. Psychoactive drugs can disrupt thinking. Alcohol again. Psychoactive drugs may affect an organ when they pass through it, or affect them when the central nervous system sends back a distorted message. Evolutionary psychologists speculate that any changes to the human form, including the brain, continued because they assisted the individual in their survival. A good example of this is the human affinity for sugar and fat, which provides a quick and more prolonged energy source. Another example would be the affinity for sexual intercourse for both males and females, which led to offspring which guaranteed the survival of the species. Following the evolutionary premise, psychoactive substances must serve some purpose. One reason may be that most psychoactive substances affect our natural survival mechanisms, but initially cause desirable effects. Eventually, as humans, we may adapt to the effects of these substances, but as for now, these substances are subverting our survival mechanisms, and in many cases, the result is anti-survival or death. The human brain not only maintains the largest cerebrum, that's the new brain, of all creatures, but all the structures of lower animals. We have the old brain just like they do. As survival became more complex, higher animal forms developed new brain structures to aid them with survival. The primitive primal or old brain consists of brainstem, cerebellum, midbrain, the mesocortex, and the limbic system. These brain structures can be found from animals as primitive as fish to humans. The old brain regulates physiological function. The respiration is regulated by the brainstem. The heartbeat is regulated by the brainstem. The body temperature is regulated by the brainstem. The hormone release is regulated by your hypothalamus and your pituitary glands. And movement, which is regulated by the cerebellum. This is your cerebellum right here, this chunk of yellow stuff right here. The old brain, the limbic system, is the area that acknowledges the experience of basic emotions and cravings: fear, anger, hunger, thirst, lust, pain, pleasure. That's all in the old brain. The old brain is the area that imprints survival memories, specifically the limbic system. Most psychoactive substances act on the old brain, causing euphoria in this area and thus providing the euphoric memories that lead to addiction. The emotions of the old brain overpower the reasoning capacity of the cerebrum and lead to the repeated taking of euphoric substances. As hominids advanced over time, that's humans and their humanoid form, more and more brain power was needed to survive. This came to us in the form of the cerebrum and the highly convoluted neocortex. The new brain aids us in solving problems of survival. Most of the time, the new brain controls the old brain. Reasoning trumps emotion. However, when a person uses psychoactive substances, the craving from the old brain may override rational arguments, geez, these drugs are too expensive, maybe I shouldn't use them. There are bad side effects, but they feel so good. They're dangerous, I may kill myself, but they feel so good. I have other responsibilities that are more important than my pleasure, but they feel so good. The reward reinforcement pathway encourages a human to perform or repeat an action that promotes survival. It is this pathway that is affected by the psychoactive substances. Also referred to as a mesolimbic dopaminergic reward pathway, it has a stop switch, the orbitofrontal cortex, and a more switch. The more area is also known as the pleasure center and encompasses four structures: the amygdala, the lateral hypothalamus, the nucleus accumbens septi, and the ventral tegmental area. The pleasure center serves two purposes. It gives a feeling of satisfaction when a need is fulfilled, or even the anticipation that a need will be fulfilled. It gives a surge of relief or intense satisfaction when a pain is diminished. So it either, if something feels good, it tells you to keep going. If you have a pain and it goes away, it tells you, oh, that sure feels a lot better. Psychoactive substances activate the pleasure circuit and rewards the individual with a feeling of satisfaction or pain relief. Unfortunately, psychoactive substances overactivate the pleasure center and shut down the stop switch, enabling the individual to feel an intense need to continue use. Three phases of brain activity with a reward reinforcement pathway. 1, the anticipation of drug use or compulsive drug creates craving. Compulsive behavior creates craving. Internal or external cues activates the amygdala, which causes the release of dopamine from the ventral tegmental area, which in turn activates the nucleus accumbens, causing craving. For an alcoholic, passing a bar, that's the external cue, would activate the amygdala, causing a release of dopamine from the ventral tegmental area, which would activate the nucleus accumbens, causing a craving for alcohol. For someone who smoked pot with their friends before they went away to school, when they see their friends on spring break, external cue, it would activate the amygdala, causing a release of dopamine from the ventral tegmental area, which would activate the nucleus accumbens, causing a craving for pot. The second phase of the reward reinforcement pathway involves the brain telling the individual to do it again after ingesting the psychoactive substance. With use, dopamine is released from the ventral tegmental area, which activates the nucleus accumbens to continue the craving. Phase 3 of the reward reinforcement pathway involves the nucleus accumbens signaling the orbitofrontal cortex that it has taken in the substance and asks for a signal of more or satiation. In addicts and abusers, this signal is weakened, as is the reasoning function of the area, resulting in ingestion that does not lead to satiation. Psychoactive substances imprint the memory of euphoria or pain relief more deeply than most natural survival memories. The alteration of brain chemistry causes normal activities to be less pleasurable. To a methamphetamine addict, the desire for the drug will be more important than her relationship with her children. And If you don't believe me, then you can ask police. Sometimes people that are addicted to methamphetamines will try to sell their children for sex so that they can get another fix. Sometimes they'll sell their children completely, as ugly as that may be. To the compulsive gambler, gambling will become more important to them than food or sex. Psychoactive substances tend to affect the physiological function of the body, especially heart rate and respiration. It is the effect on the respiration that causes most drug overdose, emergencies, and death. Psychedelics, LSD, marijuana, and the rave drugs not only affect the old brain, but the new brain as well. These drugs especially affect memory as they activate two areas of the brain that help to control memories, the amygdala and the hippocampus. As people age from childhood to adolescence to adulthood, they learn to integrate the drives of the old brain with the reasoning and common sense of the new brain. Developmental problems, childhood traumas such as chaotic or abusive childhoods, compulsive behavior or psychoactive drug use can circumvent survival mechanisms and lead to irrational behavior or addiction. The most important structure of the reward reinforcement pathway is the nucleus accumbens septi. This bundle of nerves is the most powerful reinforcer in the pathway. It is this area of the brain that drives people to action. Research with rats stimulating this area of the brain led to death. They could do nothing else but stimulate this area. Human subjects who stimulated the same area behaved in a similar manner to the rats, but of course they didn't allow them to stimulate themselves to death. Social factors tend to affect the obsession to use a psychoactive substance. The psychoactive substance alters the brain chemistry to make the individual want to use. This is one reason why only complete abstinence will stop the craving. To begin again will lead to the craving starting at the same intense level. Brain imaging has shown that brain cells change as addiction develops. While normal memory doesn't take place until an action has been repeated 3 or more times, intense stimulation can cause sensitization with just one encounter. These neural pathways are highly sensitive and may cause relapse in just one additional encounter. Why do psychoactive drugs disrupt the on-off switches of the reward reinforcement pathway? One theory is that since they don't originate from an essential body need, the brain has no satiation point established for psychoactive substances. A second theory is that the on-off switch gets stuck in the on position. The person doesn't realize that the act has been completed. The person will use until they run out of the drug or pass out. And in this case, he passed out. The third theory is that the psychoactive drug creates such euphoria or pain relief that the on-off switch is ignored or overridden by the brain. A fourth theory is that the psychoactive substance disrupts communication between the old and new brains. Many psychoactive substances incapacitate the thinking and reasoning portion of the new brain, and the individual reverts to old brain instincts or automatic functioning. And how he got in there, I have no idea. How could you close the door? The main instrument of the nervous system is the neuron. The neuron is composed of the soma, the axon, and dendrites. Information comes into the neuron through the dendrites and is distributed to other entities through the terminal or terminals at the end of the axon. Each neuron can make contact with one entity up to 150,000. It is estimated that there is between 100 trillion to 500 trillion neuronal connections in the human body. Neurons are different lengths from fractions of millimeters to the sciatic nerve that can be a meter long and runs from the heel to the spinal column, depending on how tall you are. That's how long your sciatic nerve is. How long your legs are, I guess. Neurons do not touch, but they do communicate with one another. This communication takes place in the synaptic cleft, a gap between the two neurons. In order for the two neurons to communicate, a chemical messenger called a neurotransmitter must pass between them. The neurotransmitter is housed in tiny sacs called vesicles. And these are vesicles right here. This is the axon terminal, and these are the vesicles. And they are releasing the neurotransmitter. And these are the receptor sites down here. They are receiving the chemical and reacting to whatever it is that the chemical is supposed to make them do. Acetylcholine, neurotransmitter that activates muscles. It works as a vasodilator. It controls mental acuity, memory, and learning. It decreases with age, causing rapid dementia, referred to as Alzheimer's disease. Does this mean that because I'm 72 years old that I have Alzheimer's disease? Probably not. I seem to be fairly lucid at this point, even though I can't read very well. This is the first neurotransmitter that was ever discovered. It was acetylcholine. Norepinephrine and epinephrine, the second two neurotransmitters discovered. They act as stimulants when the body demands energy. They control hunger, attention span, motivation, confidence, and alertness. Epinephrine gives you energy, and norepinephrine gives you confidence and feelings of well-being. There you go, confidence and feelings of well-being, norepinephrine. Dopamine regulates fine motor muscular activity, emotional stability, satiation, and of course it is what fuels the reward reinforcement pathway. Dopamine is the most important neurotransmitter involved in drug abuse. Reduced dopamine leads to Parkinson's disease. Parkinson's disease is a disease where you have a difficulty moving. You tend to have tremors in your hands. If you've seen Michael J. Fox within the last 10 or 15 years, he's suffering from Parkinson's disease, and you can see how it is or how it has progressed with him. Excess dopamine causes schizophrenia. So too much, and you got schizophrenia. This is a picture of a cat, and this guy was going into a psychotic episode, and the deeper he got into his psychotic episode, the more he saw that cat as a different entity. So too much dopamine causes schizophrenia, too little causes Parkinsonian symptoms. Histamine controls the inflammation of tissues and allergic reactions. It regulates emotional behavior and sleep. So if we give you a shot of histamine, we wouldn't give you a shot of histamine. We give you an antihistamine so that the inflammation will be reduced. Serotonin controls mood stability, depression, appetite, sleep, sexual activity. Mood can be elevated by forcing more serotonin into the synaptic cleft. Enkephalins, endorphins, and dynorphins are involved in regulation of pain, relief of stress, immune response, stomach activity, other physiological functions. Now, the reason that there are three of them. Endorphins, the reason they named morphine, the opiates, the reason they named it endorphin is because it inhabits the same receptor sites as morphine does, as the opiates do. Okay, so since I'm not sensitive to opiates, guess what else? I don't have endorphins. I have enkephalins and dynorphins. I don't really have a problem with pain. But I do not get runner's high, which is a little sad. And that may be one of the reasons why I'm a sprinter instead of a long distance runner. Gamma-aminobutyric acid, or GABA, it is the main inhibitory neurotransmitter. It's involved in 25 to 40% of all the synapses in the brain. It controls impulses, muscle relaxation, arousal. It slows down the brain. Alcohol has a strong effect on GABA. It's inhibitory. So once you drink alcohol, all of a sudden your some of your inhibitory properties go away. So now you will do things that you wouldn't do otherwise, like dance with a lampshade on your head. Glycine is an inhibitory neurotransmitter. It's found in the brainstem and spinal cord. It slows down the brain. It's prominent in protein synthesis. Glutamic acid in the form of glutamate and glutamine is an important excitatory neurotransmitter. It plays a major role in cognition, motor function, sensory function. It reinforces your memory. It's the precursor for GABA, gamma aminobutyric acid. Substance P, the P stands for peptide, conveys the pain message to the brain from the peripheral nervous system. Enkephalins block substance P, and that's why enkephalins work. And it looks like this guy needs all the enkephalins he can get. Wow, that soccer ball really smashed out against his face, didn't it? Anandamide has an affinity for the receptor sites that accommodate THC. It's found in the limbic system. Integration of sensory experiences with emotion. It controls learning, motor coordination, and memory. It acts as an analgesic. In other words, it takes away all the pain. Anandamide. Anandamide's kind of funny because we didn't know it existed for the longest time. We couldn't figure out what THC was doing in the nervous system. We knew that it gave you the munchies when you smoked marijuana. We knew that it affected your short-term memory and your long-term memory, for that matter, and we knew that it took away pain. But we didn't know what receptor sites that it was inhabiting. And then we discovered anandamide, and anandamide, of course, does all these things, and that's what marijuana does too. So here you go. Now we understand. Corticotropin, ACTH, and cortisone aids the immune system. It helps healing, part of the stress control substance. Nitric oxide, since it was discovered in 1992, the functions of nitric oxide just continues to expand. It is necessary for the erectile function of the penis. It helps regulate emotions. In too large dosages, it can cause cancer and vascular collapse, and of course, that's a good reason not to take too much of it. But until we discovered that nitric oxide did this, there were no erectile dysfunction medications. And since then, of course, now we have them. Alcohol directly affects GABA, metenkephalin, and serotonin. Benzodiazepines directly affect GABA and glycine. Marijuana directly affects anandamide and 2-AG, acetylcholine, and dynorphin. Heroin affects endorphin, enkephalin, and dopamine. LSD affects acetylcholine, dopamine, and serotonin. Nicotine affects epinephrine, endorphin, and acetylcholine. Cocaine and amphetamines, dopamine, epinephrine, norepinephrine, serotonin, and acetylcholine. MDA and MDMA, which are the rave drugs, serotonin, dopamine, epinephrine, and norepinephrine. PCP, angel dust, dopamine, acetylcholine, and alpha-endopsychosine. Neurotransmitters attach themselves to receptor cells on the receiving entity, muscles, organs, and other neurons, that are chemically structured to only accept the neurotransmitter. However, select receptor sites may have different functions for the same neurotransmitter. There are seven types of serotonin receptors, each of which has a slightly different function. Dopamine has 5 types of receptors, referred to as D1 through D5. It's the D2 receptor. It's the site which is used by most psychoactive substances, the D2 dopamine receptor site. Each neuron maintains and transmits only one type of neurotransmitter, except for neurons that transmit epinephrine, which may also transmit norepinephrine. However, a neuron may have receptor sites for any number of neurotransmitters. A neuron is stimulated when it receives enough neurotransmitter to create a chemical imbalance in the neuron that forces sodium and potassium gates to open. The increase of positively charged sodium and potassium ions from outside the neuron and the flooding out of negatively charged chloride ions causes an electrical chain reaction to run down the neuron to the axon terminal. At the axon terminal, the electrical stimulation causes the vesicles to release their neurotransmitter into the synaptic cleft, which in turn stimulates a partner neuron. Excitatory neurotransmitters work by opening sodium gates, allowing sodium into the neuron. Inhibitory neurotransmitters work by opening chloride gates, making the neuron more negative and thus more difficult to stimulate. The stimulation of the neuron by the neurotransmitter is known as the first messenger system. If the neuron is stimulated by another entity, such as a biological or chemical change, it is known as a secondary messenger system. The neurotransmitter can't remain in the synaptic cleft or the reaction won't stop, so it must be removed. This occurs in one of two ways. The neurotransmitter is chemically broken down. Acetylcholine is broken down by acetylcholinesterase, or the neurotransmitter is taken back by the neuron that originally distributed it in a process known as reuptake. And if you've ever heard of selective serotonin reuptake inhibitors, that's what's going on with serotonin. Serotonin is being blocked from being taken back into the neuron, and therefore selective serotonin reuptake inhibitors inhibit the reuptake of serotonin selectively. The number of receptor sites is not constant. When the amount of neurotransmitter decreases, the cell will increase the number of receptors so that as much neurotransmitter as possible finds a place to attach, and this is known as upregulation. So the more receptor sites you have, the more likely that a neurotransmitter will find a receptor site to attach itself to, and that's known as upregulation. If there is too much neurotransmitter in the synaptic cleft, the number of receptor sites will decrease to prevent overstimulation. This is known as downregulation. Okay, so when you take a drug, the first time you take it, you get this extreme reaction. But those neurons are being overstimulated. So one of the things that happens is a downregulation because they don't want to reach a toxic level where the neuron dies. So they downregulate. They reduce the number of receptor sites. So the next time you take that drug, if you take exactly the same amount, then you won't get the same reaction that you did the first time. Because the first time you had more receptor sites. Now you have fewer receptor sites, same amount of drug, you're not going to have the same reaction. This occurs when someone takes drugs, the individual takes more and more. Okay, this is one of the reasons why you have to continue to take more and more drugs. Of course, the other problem is if you take an excessive amount of drugs, then you cause a permanent downregulation of the receptor sites. Psychoactive drugs work because they act as either agonists or antagonists. Agonists either mimic or facilitate the effects of a neurotransmitter. Nicotine affects acetylcholine, ethanol affects GABA, LSD affects serotonin, and THC affects anandamide. If this happens partially, it is known as a partial agonist. Antagonists block neurotransmitters. If the receptor is stabilized, making it inactive by a drug, the drug is referred to as inverse agonist. How drugs affect neurotransmitters? They can block the release of the neurotransmitter. Heroin blocks the release of substance P. Substance P tells you when you're in pain. Now the heroin has told you that you're not in pain because it's blocked the substance P. They can force the release of neurotransmitters, forcing more to be released than is released naturally. Cocaine forces the release of norepinephrine and dopamine. Ecstasy, MDMA, forces the release of serotonin. The drug can prevent the reabsorption of the neurotransmitter. Selective serotonin reuptake inhibitors block the reuptake of serotonin, elevating the person's mood. The drugs can inhibit an enzyme that helps synthesize the neurotransmitter. Blood pressure medicines inhibit enzymes that allow the production of norepinephrine, which would cause high blood pressure if allowed to be released in the synaptic cleft. Drugs can inhibit enzymes that break down neurotransmitters in the synaptic cleft, allowing the neurotransmitter to remain in the cleft. Methamphetamine inhibits monoamine oxidase and catechol-O-methyltransferase, which break down norepinephrine and epinephrine in the synaptic cleft, which means there's more norepinephrine and epinephrine in the synaptic cleft. The drug can interfere with the storage of the neurotransmitter. The drug can do a combination of any of these interactions. While some drugs have desired effects, like making the individual resist fatigue or block pain, they can also be dangerous. Cocaine forces the release of norepinephrine and dopamine, which makes the individual not only stay up beyond normal exhaustion, but responds in an overly excited and sometimes violent manner. Heroin blocks pain and creates a euphoric sensation by attaching to receptor sites in the reward reinforcement pathway, but unfortunately also attaches to the breathing center, depressing respiration, which means you can't breathe and you die. LSD acts as both a stimulatory neurotransmitter and alters the user's perception of external messages, mixing their perceptions so that they may hear images and see sounds. This is known as synesthesia. Other psychedelics block the action of acetylcholine, creating hallucinations. The body may deal with drugs in several ways. You may build up a tolerance to it, you may become tissue dependent, you may become psychologically dependent, you may have withdrawal symptoms, or you may just break the drug down. And that's what I do with opiates and opioids. My body just breaks the drug down. Any foreign substance will be treated as a toxin in the body. The liver and the kidneys will try to eliminate it so that it cannot do any damage. If the individual continues to use the substance, the body will adapt to having the drug present. This adaptation to the presence of a toxin is called tolerance. Tolerance to drugs will force the individual to take more and more of the drugs to get the same effect. Methamphetamine users will achieve a certain level of euphoria and energy the first time they use it. If they use every day for 100 days, by the 100th day, they will have built up a tolerance for the drug that will necessitate a 20 times increase on the amount that they used the first time. And they will do it, as you can see. This is after a year and a half. This is after 3 months. You can see what a mess this guy is. He lost a ton of weight. This is after 2.5 years using crystal meth. In order for tolerance to occur, sometimes the drugs must be taken irresponsibly. If the individual is taking Valium at higher doses than the doctor prescribed, or the doctor is prescribing heavy usage of the medication, the tolerance will be accelerated. Research shows that there are individuals who have built up a tolerance to the degree that they were using 100 to 200 times the standard dosage. Tolerance will return to normal if the drug is no longer used. Types of tolerance: dispositional tolerance. The body accelerates the metabolism of the drug by producing more of the enzyme used to metabolize the toxic substance. The more people drink alcohol, the greater their tolerance because of dispositional tolerance. Thus, the individual will have to consume high levels of alcohol to become intoxicated. Pharmacodynamic tolerance is affected nerve cells become less sensitive to the drug. When opioids are used, neurons begin generating fewer receptor cells to the opioid to lessen its effects. The body will also produce cholecystokinin as an antagonist to the drug. Behavioral tolerance: the brain compensates for the effects of the drug by using parts of the brain not affected. A person who is drunk can force themselves to appear sober when necessary. Reverse tolerance: as the drug destroys tissue, the user becomes more sensitive to the drug and can tolerate less and less of the substance. This happens to alcoholics who suffer from cirrhosis of the liver. Since the liver doesn't work as well, a little alcohol will get them drunk because the liver is not operational enough to metabolize the alcohol. Acute tolerance: tachyphylaxis. The brain and body adapt instantly to the toxic effects of the drug. Tolerance to tobacco occurs this way. People who try to commit suicide using barbiturates may experience the same instant tolerance and survive twice the lethal dosage. LSD will not work if 2 doses are taken close together due to tachyphylaxis. Select tolerance: the body develops tolerance to mental and physical effects at different rates. This occurs with opiates and sedatives. With barbiturates, sleep will be induced long after the euphoric effect is no longer present. Inverse tolerance or kindling. The brain chemistry changes so that the person becomes more sensitive to the effects of the drugs. With continued use, cocaine and marijuana users will get a minimal effect, and then after months will start to get an intense reaction. In the case of cocaine, it might cause heart attack or stroke, despite the fact that they've been using the same amount for a number of months. If a person develops a tolerance for one drug in a family of drugs, they will be tolerant of other drugs in that family. The opioid family is this way. Tolerance to heroin will make a person equally tolerant of morphine, codeine, and methadone. A person tolerant of Xanax will be tolerant to other benzodiazepines, even the depressant alcohol. A person tolerant to barbiturates will be tolerant to benzodiazepines. Tissue dependence, this is the biological change of the body to adapt to the presence of the drug. This usually occurs after prolonged use. Allostasis sometimes will occur where the tissues and the organs of the body depend on the drug to be functional. In these circumstances, cessation of the drug usage will cause dangerous and dramatic withdrawals. Sorry, I needed a drink. Not of alcohol, of course. In select circumstances, cross-dependence will occur where dependence of one drug can be alleviated with another drug. Psychological dependence, addiction used to mean that the person taking the drug was tissue dependent on the drug. But with continued research and brain imaging technology, it has been recognized that psychological dependence is an important factor in addictive behavior. The altered states of consciousness that are caused by select drugs can lead to continued misuse to avoid life's problems. It is now acknowledged that psychological dependence occurs before tissue dependence and that the response rate from either is similar. Psychological factors that induce reinforcement, drug automatism. Individual uses the drug aimlessly, unconsciously, and repetitively. This happens with crystal meth. Negative reinforcement, unpleasant states encourage drug usage. Smokers will wake up in the middle of the night to smoke to dissipate nicotine withdrawals. Social reinforcement, peer pressure, and the need for social inclusion encourages continued use. Physiological responses to drug opioids makes you numb, it gives you euphoria, it dries out your mouth, it makes you constipated, it decreases your pulse, slows down your circulation, it lowers your blood pressure, it gives you shallow breathing and the inability to cough. It gives you pinpoint pupils and it gives you malaise. Withdrawal symptoms from opioid substances, tactile it's the very opposite of the opioid effects. So the withdrawal symptoms, tactile reaction, you're very sensitive to pain, psychological reaction, anxiety, depression, or craving. Physical excretory reaction, sweating, runny nose, tearing, increased salivation. Digestive tract reaction, instead of the constipation, you have diarrhea. Circulatory reaction gives you hypertension. A respiratory reaction, it gives you excessive coughing because you couldn't cough before. You couldn't clear that phlegm from your respiratory tract. Now all of a sudden you can't stop coughing. Optic reaction, dilated pupils. Muscular reaction, severe hyperreflexes and muscle cramps. Sounds wonderful. Drug withdrawal is the body's attempt to rebalance itself after cessation of prolonged use of psychoactive substances. Many times for chronic user, fear of withdrawal is one of the reasons for continuing to use. Withdrawal often entails muscle aches, pain, insomnia, vomiting, cramps, and on occasion convulsions. Nonpurposive withdrawal, visible physical signs due to tissue dependence, seizures, sweating, goosebumps, or crawling flesh, vomiting, diarrhea, and tremors. That's the nonpurposive withdrawal. Purposive withdrawal, expectation of withdrawal symptoms causing the rationalization of continued use of the psychoactive substance. Withdrawal effects can be observed whether there is tissue dependence or not. Protracted withdrawal, heavy craving for the drug even after the addict has been detoxified. This is usually caused by an external cue that causes the subject to have flashbacks to use and withdrawal symptoms. This often causes a recovering addict to relapse, unfortunately, and we see this all the time. Post-acute withdrawal symptoms, persistent emotional and physical problems that last from 3 to 6 months after recovery, unclear thinking and cognitive impairment, memory problems, emotional overreaction, sleep disturbances, motor coordination, dizziness problems, difficulty managing stress, and craving the drug. Sometimes drug abuse is the symptom of other underlying problems. When this is the case, the user will sometimes seek the desired effect by experimenting with drug usage. A replacement will replace the desired drug with another intoxicant. Multiple drug use of different drugs to alleviate differing symptoms. Cycling, using a drug intensely for a period of time and then abstaining to lower tolerance or allow the body to repair. And this is what killed Amy Winehouse. She went on a bender after she hadn't had anything to drink for a number of months. Since she had built up a tolerance before using alcohol at this level, because she had been sober for a number of months, the alcohol killed her. A lower level of alcohol killed her than it would have before because she was cycling. Stacking, using 2 or more similar drugs at the same time to achieve a specific effect. Mixing, using drug combinations to acquire a new effect. Speedballs, or cocaine and heroin. This is what killed John Belushi and Chris Farley. Marijuana laced with cocaine. Ecstasy and LSD, it's known as X and L. Methadone and Klonopin, it mimics heroin. Sequentialing, going from one addiction to the other. This can either refer to drug sequentialing, drug replace by a compulsive behavior, or one compulsive behavior replacing another. Morphing, using one drug to counteract another. A cocaine user drinking alcohol to come down, using coffee to come down off of a drunk, using methamphetamine to function during a heroin high. Level of use is determined by the amount used, the frequency of use, the length of time psychoactive substances have been used, the impact the drug usage has on the user's life. Categories of usage include abstinence, experimentation, social recreational use, habituation, abuse, and addiction. Many individuals cannot choose their level of drug use, but are at the mercy of the psychoactive properties of the drug being used. Abstinence means that an individual does not use any psychoactive substances except accidentally. Even if the person has a strong hereditary or environmental susceptibility for compulsive drug use, by never starting, they never get hooked. These individuals might display other compulsive behaviors such as gambling, overeating, compulsive internet use, or excessive sexual behavior. Research shows that individuals who wait until they are 18 years or older to experiment with alcohol, nicotine, or marijuana are less likely to use these substances as gateway drugs for more dangerous substances such as cocaine or heroin. However, if the individual experiments between the ages of 10 and 12, they are more likely to use the early experimentation as a gateway to more serious usage. Individuals who don't start smoking until age 21 are very unlikely to develop an addiction to nicotine. Anyone who doesn't try an addictive substance until age 21 will probably not become addicted. Experimentation with psychoactive substances occurs because of curiosity, but no pattern of usage is developed, and there are no negative consequences from the experimentation unless usage leads to injury, accident, or illness, the individual has an exaggerated reaction, a pre-existing physical or mental condition is exacerbated, the user is pregnant, the individual is arrested for its use, heredity or environment dictates addiction, previous addiction with other substances leads to relapse. Social recreational users may seek out a drug for the effect, but no permanent pattern of use is developed. Usage can be controlled for these individuals as long as they do not develop drug-seeking behavior. The habituation, the individual has developed a pattern of usage, but there has been no negative effects on the individual's life. This is referred to as habituation because though there is no increase of usage, the usage pattern indicates that there is a definite craving for the substance. Abuse, the individual continues to use the substance despite the negative life consequences that have occurred. These consequences can be personal, their relationships, problems in their social lives, financial, legal, continued use despite arrest for possession, medical, personal health, alcoholic with diabetes, heavy smoker with emphysema, the cocaine user with hypertension, work or school related, emotional stability, LSD user with mental instability. The difference between abuse and addiction is the compulsive behavior of the addict. Addiction is a classification if the individual has no control over duration of usage or the amount used. The individual has been unsuccessful at control. They spend an inordinate amount of time obtaining drugs or recovering from usage. They limit social, occupational, or recreational activities for use. They continue use despite physical, social, relationship, or psychological problems. They use in the morning for a jump start on the day. They defend their drug usage with anger or even rage. They experience withdrawal when unable to use the drug. They must increase the amount used to obtain the desired effects. Addiction compromises the 4 C's: control, loss thereof, compulsive use of the drug, craving the drugs, and continued use of the drugs, the 4 C's. The American Psychiatric Association has identified substance use as a mental illness since the printing of their first diagnostic and statistical manual of mental disorders in 1952. The current DSM-5 divides substance abuse disorders into 2 general categories: substance-related disorders and substance addictive disorders. The DSM-5 deals with several drugs, which include alcohol, stimulants, cannabis, marijuana, cocaine, hallucinogens, inhalants, opioids, anxiolytics, sedatives, hypnotics, caffeine, and tobacco. The addictive disease model, this model of addiction sees addiction from the medical point of view. That addiction is a disease. It's chronic, it's progressive, it's relapsing, it's incurable, it's potentially fatal. This model assumes that the addiction is caused from genetic irregularities in brain chemistry and anatomy that are triggered by certain drugs. Research shows that heredity influences drug use and addiction as much as 40 to 60%. Compulsive drug, the addictive disease model, compulsive drug use with prolonged intoxication with the need to continue use, the inability to control use, the inability to stop use despite physical, mental, or social problems, repeated attempts to control use, increase intake over time, it's incurable, pathological reactions such as blackouts or dramatic personality changes. Behavior emotional model, this theory purports that negative environmental factors such as abuse, anger, and peer pressure may cause people to seek, use, and sustain a dependence on substances. This model emphasizes the progressive nature of the 6 levels of drug use: abstinence, experimentation, social recreational use, habituation, abuse, and finally addiction. The academic model, the addiction occurs when the body adapts to the toxic effects of the drugs at the biochemical and cellular levels. Natural balance has been thrown off, causing four physiological changes: tolerance, tissue dependence, withdrawal syndrome, and psychological dependence. The diathesis stress model, this model was first developed to explain the causes of schizophrenia. It is a combination of the addictive disease model and the behavioral environmental model. Diathesis means a predisposition or vulnerability to, and in this case, the individual may have a genetic and environmental predisposition to drug addiction. Stress triggers the drug need, and the stronger the diathesis, the more likely that the individual will drift into addiction. Heredity, researchers have found that genetics does influence addiction, but that there are over 100 genes that have something to do with drug abuse. Receptors, gene transcription factors, enzymes, neuropeptides, G proteins, and transporters. Looking at twin studies, Goodwin found that of identical twins separated at birth were most likely to choose the addiction or abstinence patterns of their biological parents over their adoptive parents. Similar research found that 61% of the sample maintained nicotine dependence similar to their biological parents, and 55% displayed the same alcohol dependence of their parents. Researchers looking at males in treatment found that children with one alcoholic parent had a 34% greater probability of being an alcoholic than the male children of the non-alcoholic. When both parents were alcoholics, the child had a 400% probability of being an alcoholic. If both parents and a grandfather were alcoholics, the individual had a 900% greater probability of being an alcoholic. 28 million Americans have one parent who is an alcoholic. Researchers have found that 70% of severe alcoholics have a dopamine control gene called DRD2A1. Among social drinkers, only 30% have the gene. When this gene is present, the individual has fewer dopamine receptor sites in the nucleus accumbens. Since many of the missing sites are D2 sites, the individual will need more intense stimulation to feel satisfied. The DRD2A1 gene seems to indicate the tendency for any problem behavior, as it has been found in other addictive behaviors other than alcoholism: gambling, ADHD, aberrant sexual behavior, overeating, antisocial personality disorder, and Tourette's syndrome. Some refer to this gene as the compulsivity gene, and the process as the reward deficiency syndrome. People with the DRD2A1 tend to consume large quantities of psychoactive substances before becoming intoxicated, and then have greater dysfunction when they do get drunk, such as blackouts and brownouts. There are also genes that make it less likely that a person will develop an addiction. DRD4 gives the individual an excess of dopamine, which has been shown to play a role in spiritual acceptance, making it less likely that the individual will accept the addictive lifestyle. Interactions with the environment, but especially the home environment, make new nerve cell connections and alter the neurochemistry that the individual was born with, determining if and how the individual will use psychoactive drugs. Factors in the environment: physical, sexual, emotional abuse, stress, love, poverty, living conditions, family relationships, nutritional balance, healthcare, neighborhood safety, school quality, peer pressure, the internet, and television. All of these are environmental factors. The environment molds the brain's architecture and neurochemistry, determining how the individual will react to the outside influences. This is especially true in the first 10 years of life. The brain develops from the front to the back, meaning that adolescents are more prone to more impulse control behaviors like substance abuse. Recent research shows that it takes at least 20 years for the brain to become hardwired, and the prefrontal lobe continues to grow until around the 44th year.
Memories are established through a network of neurons involving select neurotransmitters: norepinephrine, serotonin, acetylcholine, and dopamine. The more an action is repeated, the more likely the individual will remember it, unless the memory is emotionally intense, in which case the memory has a stronger memory network, hence the intrusive memories of traumatic events that may end up causing post-traumatic stress disorder. Children growing up in a chaotic environment where there is excessive emotional pain can deal with the pain in several ways. They can face the pain and try to deal with it. They can find people to help them deal with it. They can accept what happened. They can run away. They can become hyperactive. They can become angry and fight. They can make jokes. They can develop an addictive use, such as with drugs, food, gambling, or sex. If the stress continues over time, the counterbalancing behavior will become ingrained in the brain and become part of the individual's personality. In the future, when an unwanted emotion arises, they will be drawn to the simplest solution, the counterbalancing behavior. And these are all the counterbalancing behaviors. They may be a runaway. They may run away every time something traumatic happens. They may get angry and fight. They may become hyperactive. They may make jokes. They may face it. They might deal with it. They might find somebody to help them. The people most likely to abuse drugs, stress is common in their home. Abuse of some kind occurs in the home. Drugs or drinking are commonly used in the home or among the individual's peers. Healthy ways of reacting to stress and or anger aren't learned. Society tells the individual that psychoactive substances are normal and an acceptable way to solve life's problems. Living in a community where access to legal and illegal drugs are easy, there are pre-existing mental conditions exacerbated by the negative home environment. Healthy brain chemistry can't be maintained because of poor nutrition. The media inundates the individual with advertisements supporting the use of select psychoactive substances. One belongs to a peer group where excessive use of psychoactive substances is normal. Heredity in the environment may prime the individual for addictive behavior, but it is a psychoactive substance that they decide to use that will determine the impact the addiction will have on their life. Excessive drug use will not only make the individual more susceptible to more and more use, but more vulnerable to other stronger drugs. Psychoactive drugs, select psychoactive drugs, particularly methamphetamine, cause the death of brain cells through a process known as apoptosis, where damaged cells are programmed to kill themselves. Psychoactive drugs, nicotine produces an immediate long-term change in the levels of dopamine and norepinephrine, which leads to a faster development of tolerance and dependence. Some drugs have a greater power to positively reinforce and therefore compel to a continued use. And this is the way it is with cocaine and heroin. Compulsive obsessive behavior mimics drug use, which in turn causes the brain to be rewired. Gambling, eating, shopping, sexual activity, video games, and internet use. Research with video game usage has shown that dopamine is released in the reward reinforcement pathway when an individual plays video games, an amount equivalent to methamphetamine usage. Compulsive behavior, PET scans of compulsive eaters has demonstrated that there is a decreased number of dopamine D2 receptor sites in the nucleus accumbens. Research shows that between 25 to 63% of compulsive gamblers have been dependent on alcohol or other drugs in their lives. It has been demonstrated that gambling creates brain disruption similar to drug or alcohol usage. The drug that pushes the individual the hardest and quickest into addiction is smoking nicotine in tobacco. The drug that pushes the individual the second hardest and quickest into addiction is smoking crack cocaine. The drug that pushes the individual the third hardest and quickest into addiction is smoking or injecting heroin. The drug that pushes the individual the fourth hardest and quickest into addiction is injecting methamphetamine. The drug that pushes the individual the fifth hardest and quickest into addiction is snorting cocaine. The drug that pushes the individual the sixth hardest and quickest into addiction is ingesting opioid painkillers. The drug that pushes the individual seventh hardest and quickest into addiction is ingesting any amphetamine. The drug that pushes the individual the eighth hardest and quickest into addiction is ingesting sedative hypnotics. The drug that pushes the individual the ninth hardest and quickest into addiction is drinking alcohol. The drug that pushes the individual the 10th hardest and quickest into addiction is smoking marijuana. The drug that pushes the individual the 11th hardest and quickest into addiction is ingesting PCP. The drug that pushes the individual the 12th hardest and quickest into addiction is ingesting caffeine. The drug that pushes the individual the 13th hardest and quickest into addiction is ingesting MDMA, also known as ecstasy. The drug that pushes the individual the 14th hardest and quickest into addiction is ingesting LSD. The drug that pushes the individual the 15th hardest and quickest into addiction is ingesting peyote. And that is the end of the chapter. Long chapter, sorry about that. Next, I'm not sure what we do next week. Anyway, see you later.